Ezekiel Emanuel is back with us now. Dr. Emanuel, you talked about this auto-enrollment as one of the solutions for getting more people into the system. And I know that you are working with the Trump administration in terms of helping advise them. How does auto-enrollment work, and why is that a better solution than the sort of mandatory coverage that did not work?
Well, you know, we have this basic subsidy, tax credit, whatever you want to call it, for people to help them buy insurance. And if someone doesn't have insurance through their employer, doesn't have Medicaid or Medicare, and doesn't buy on the exchange, we would auto-enroll them into a basic, very basic plan. That is the basic idea. And basically, their tax credit or voucher or subsidy would be used to buy that basic plan. That's the idea. And I think, you know, again, given the options, we already use it for Medicare Part A. We know we can do it. It's not administratively simple. I will admit that right up front. But I think it's a way of getting the, 18 million American citizens who haven't got insurance into the system, even if they're resistant to buying insurance.
But don't you think that there would be major pushback, Zeke, from people on the right about the government essentially, because it's another way of forcing people to buy health insurance?
Well, are we forcing seniors to buy Medicare Part A? We force them to pay taxes while they're working, and then we give them Medicare Part A. Is that a force? I think that's something that we have long used in this country, and I think it's actually something, maybe the Freedom Caucus couldn't agree to it, but I think there are a lot of Republicans who could agree to it, and I think there's a lot of people in the country who would agree to it. I think this, again, my view is this is bipartisan. That doesn't mean the fringes on the right and the fringes on the left would necessarily agree, but let's look at the middle. That's where most Americans are, and I think it's something that would work there for most Americans. And remember, we don't have that. The question is, as you put it at the start of the interview, how are we going to get a large number of people to be in the insurance pool? If we don't have a large number of people in the insurance pool, it's not going to work. So the question is, back to you. You don't like auto-enrollment? Give me another alternative. The Republican alternative of continuous coverage and a 30% penalty definitely actually disincentivizes people from buying insurance. It's not helpful. It's counterproductive.
Zeke, we talked about the fact that healthcare is 20% of GDP now. I've seen a number of Wall Street reports that say 10 years out it's going to be 25% of GDP. So ultimately, this is an investing program, long-term investing program. So where do you see the growth in healthcare, no matter what the outcome is in terms of how we're going to pay for it? Which are the areas of healthcare that are growing? Because investing in healthcare over the last 8 years has been a very good sector to put your money in.
So let's have full disclosure here. I do work with a venture capital fund, Oak HCFT, and we do invest. And I would say our main goal in investing is places that are trying to improve quality and reduce costs. And so we have investments in primary care, investments in mental health care, investments in palliative and end-of-life care. If you ask me, those are three big areas that are going to grow. And I don't agree with the people who are predicting it's going to be 25%. I think right now America is focused on trying to get a better performing system, a high-value system, and cost control is one of the major areas. I am actually quite bullish. When the United States puts its mind to improving something, we usually succeed and succeed beautifully. I often like to say, when I was growing up, the great wine of America was Gallo. Now we're the best in the world with California and Oregon wines. When we put our mind to it, we can solve the problem.